Ever wondered where doctors place their stethoscope to hear your heart? Let's explore the four key auscultation sites for heart valves. Heart valves lie deep within the chest, but their sounds travel to specific surface landmarks. Aortic valve, best heard at the second right intercostal space, just beside the sternum. Pulmonary valve, heard at the second left intercostal space, next to the sternum. Tricuspid valve, auscultated at the fourth or fifth left intercostal space, close to the sternum. Mitral valve, heard best at the fifth left intercostal space, along the midclavicular line. To remember the order, use this mnemonic: all physicians take money: aortic, pulmonary, tricuspid, mitral. These sites help identify murmurs, valve disorders, and more. Like this? Follow for more medical made simple.